Hello everyone and welcome to this special hour-long edition of Mountain Lake Journal. I'm Tom Halleck. We are hosting a community forum this week to talk in depth about the overdose epidemic that is taking the lives of a record number of people in New York State, in the city and upstate, where drugs laced with fentanyl and xylazine are leading to more drug overdose deaths than ever. More than 6,300 New Yorkers died by overdose in 2022, up from 5,800 in 2021, according to the State Office of Addiction Services and Supports and the State Controller's Office. The spike is tied to the rise in the use of fentanyl, which is an opioid, and the medication xylazine, that more and more is being added to street drugs. In the city, fentanyl was present in 81% of overdose deaths, according to the New York City Health Department. New harm reduction efforts to combat the overdose crisis, like vending machines stocked with naloxone, a medication that can counteract opioid overdoses, and test strips. The first vending machine north of New York City has just been added to the lobby of the police department in Saranac Lake, New York. And the North Country is no exception to the sudden spike in overdose deaths involving fentanyl and xylazine.
As overdose deaths rise amidst the opioid crisis, new drugs like fentanyl have risen to prominence. Recently, Champlain Toxicology Lab and others have been finding traces of a drug called xylazine in samples. Lab scientist Andrea Bellick has worked extensively with xylazine samples.
We first started seeing xylazine many years ago in biological fluids that we were analyzing, whether it be blood or urine. So we would see it in samples that might have had cocaine in because it was being used as an adulterant or a cutting agent. What it actually is a veterinary sedative and tranquilizer.
In the village of Malone, police responded to multiple xylazine overdoses in July. Police Chief Christopher Primo said it was the worst point they had seen the drug crisis reach thus far.
Well, we had 4 non-fatal overdoses and 1 fatal overdose about a month ago, 6 weeks ago. So people are dying from this. And 2 of the individuals had to have CPR done on them, and thankfully they were brought back by the EMS service.
Xylazine is a sedative, so it's going to compound any sedating effects that they get from using fentanyl.
What's happening is they're mixing it, it's being mixed with fentanyl as well, or cocaine, and that's having an effect, and people are dying from this.
Some people do seek that out, but I think a lot of the population is using without realizing they're getting xylazine as well. The big issue is when people are overdosing, it's not just the fentanyl overdose at this point, it's also the xylazine is playing into it. So Narcan does not reverse a xylazine overdose.
Joseph Kennedy has experienced the difficulty of treating xylazine overdoses firsthand as a medical toxicologist and emergency physician at the UVM Medical Center.
It makes things a bit tricky because unlike just having one drug or substance you're worried about treating, there's a whole host of different pharmacologic interactions, manifestations, the way the drug can interact with other drugs somebody is exposed to.
So what Narcan does with opiates is if you've got an opiate and you've got somebody in withdrawal, the opiates they're taking are on these receptor sites, and they're hanging out on these receptor sites, and that's what's causing the overdose. What Narcan does is it pushes whatever opioid that the individual's being affected by and jumps on that receptor site and pretty much immediately pulls them out of that high. So the xylazine does not attach itself to the same receptor sites as the opioids.
While Narcan may fail to reverse a xylazine overdose, there are prevention measures that can be taken.
There are test strips available, like there are fentanyl test strips available. There are now xylazine test strips available. We were one of the first of the smaller labs to start testing for it. It'll be a year in November. And we didn't see a lot at first. We saw a little bit here and there, but we're starting to see more and more. We do xylazine testing for free. So any cocaine, methamphetamine, or fentanyl sample that comes in, we do test them for xylazine, and we are seeing it.
Wherever xylazine is used recreationally, unique and disturbing side effects are often reported.
People using drugs with xylazine in them, they're experiencing some unusual blackouts. They may be passing out in places that are unsafe.
Another interesting way that I think xylazine has been affecting our local hospitals is we're, at least anecdotally seeing an increase in the number of patients who are presenting with skin and soft tissue injuries.
While xylazine-related medical emergencies can put a strain on emergency department resources, some believe education may prove an important tool.
We're fortunate enough to have several great agencies that are working toward education and assistance for people with substance use disorder, medication-assisted therapy. Education's always going to be beneficial when it comes to this.
Andrea says that if you see an overdose that you think may be due to xylazine, there are ways you can help.
Call 911. If you've got Narcan, administer it. Always administer Narcan if somebody appears to be overdosing, because it's not going to hurt them if it's not an opioid, and it's certainly going to help them if they have opioids on board as well. And what they're also recommending is giving rescue breaths. The DEA, they'll get their hands around this, and we'll figure it out. But there's always going to be something else to take its place. So that's really what we have to focus on, as well as trying to keep people as safe as possible.
State leaders say there is hope in the battle against this epidemic. The state has been awarded more than $2.5 billion in pharmaceutical settlement money that will now be used to combat drug addiction and pay for addiction treatment and prevention programs. This week, we're hosting a discussion to talk about some of those new initiatives and programs aimed at combating New York's overdose epidemic. Let's introduce you now to our guests who are joining us to talk about the overdose epidemic. Chief Darin Perrotte is Chief of Police in Saranac Lake, New York. Vanessa Cappon is the Assistant Director of Program Services with the Alliance for Positive Health, based in Plattsburgh. Zachary Randolph is the Associate Vice President of Operations at St. Joseph's Treatment and Recovery Centers in Saranac Lake, New York. And Michael Carpenter is the President and CEO of the MHAB Life Skills Campus here in Plattsburgh. Welcome to you all. We appreciate you being here. Police departments across the North Country say they've seen an increase in the number of overdoses and even fatal overdoses involving a drug many communities haven't seen before called xylazine. We just heard a little bit about it, a sedative used by veterinarians on animals. How prevalent has this drug become here in northern New York? Chief, why don't we start with you?
Sure. So certainly we are seeing it regionally. So it is here, and that's one thing for folks to understand is this is not a problem that's across the country or in other states. It's here in the North Country. It's in our region. As we just saw, Malone dealt with several overdoses from xylazine. In Saranac Lake in particular, we haven't experienced xylazine overdoses per se, but that doesn't mean that we don't think that it's here. Certainly, we're seeing overdoses, we're seeing fentanyl, and there's no question that it's here in the region.
Zach or Michael, are you seeing it on your campuses?
Well, much like the chief said, in Saranac Lake, we also haven't seen it in our outpatient clinics, but we have seen and heard anecdotally, and then of course our residential programs, we treat people from any county in New York State, so we have seen individuals come in that have talked about and experienced the use and the effects of xylazine as an overdose.
I think peripherally we hear about it, and I think certainly it comes up here and you see spikes in it and then it diminishes, but we haven't had any firsthand experience with it at MHAB.
And Chief, as we heard from retired Chief Primo, he warned that xylazine was being combined more and more with fentanyl and other drugs, and in the case up in Malone. What are the risks and dangers of that?
Sure. So I think with any drug that folks are grabbing off the street, we don't know what's in it, right? So these folks that are suffering from the opioid abuse epidemic, they're very sick. They are willing to do whatever it takes to get the drugs that they want, and they don't know what it is that they're ingesting. So, I think the danger is we just don't know what is in these drugs that are being bought off the streets. And, dealers are in this for profits. And so if it means cutting their drug with something that may harm someone to make it stronger, more potent, more addictive, then certainly they're going to do so.
And we heard Chief Primo say he believes that's the case, that they're seeing dealers from larger cities coming into their communities, and that's where the xylazine is coming from. Is that likely what we're seeing in other communities as well?
Absolutely. A lot of the drugs that we're seeing come in are coming from larger cities. And like I said, I mean, the drug dealers that are out there are seeing an opportunity to prey on folks who are addicted in our small communities. So coming in from the larger cities a lot of times yields them a higher profit, and it's all business to them. A lot of what we see with the folks that we're dealing with are not big-time drug dealers. They are folks that are addicted themselves that are trying to feed their own habits.
And if you're not seeing as much xylazine, is fentanyl the bigger concern right now?
Fentanyl is certainly something that we've been seeing a lot of, and we're seeing it across the board, whether it's heroin, cocaine. We've even seen fentanyl pop up in marijuana that we've come across. So it is certainly out there, and it's alarming.
Vanessa, have you seen a lot of fentanyl in the communities, and have you been helping people who are using fentanyl?
Yeah, so our participants, they report overdoses to us. The majority of them are still related to fentanyl. We've had a couple that were related to xylazine, but through the summer, the majority of the overdoses are still related to fentanyl, and so we're supporting our participants in any way we can. We provide them fentanyl and xylazine test strips anytime they come in, along with Narcan.
And we've heard for some time now about the potency of fentanyl, making whatever they're mixing it with 50, 100 times more potent. Is that the biggest risk from fentanyl, is that it just makes the street drugs so much more dangerous?
Absolutely. Much more dangerous, much more addictive, and people just don't realize that the smallest amount of fentanyl can be lethal.
And to what we're seeing is the cutting of substances it used to be the business was let's cut it to make it less potent so that people would need to buy more. Now it's let's cut it to make it more addictive so we get more customers faster. And that's where the danger and the risk really inherently goes through the roof with individuals, is they don't know what's in their substances.
And that's a real concern, because if they don't know what's in their street drugs anymore, that's the danger.
That's right.
And I think, to make a point, I don't necessarily think that it's that people are willing to take the risk. I think it's that these people are so ill, and if somebody told you, here's this medicine and it'll make you feel better, I think they're just willing to do whatever it takes to make them feel better.
And Tom, if you think about somebody that's afflicted with this illness, there's a couple of things that kind of seem to find their way in as we progress in the illness. You can liken it to the crack cocaine epidemic of the 80s. Part of the reason why crack cocaine became so prevalent was you could get the high at a much less cost than what powder cocaine was. You see the same thing now. Drug dealers cut it with things that make it more potent and also allow people to buy it for less money. And as somebody that has been, clean for a long time, when you're afflicted with this, you're looking for something that doesn't cost a lot, something that will last a long time, or something that you can use regularly. And so when I was using, I could run a test and find out that this is pure cocaine or close to pure cocaine, and this has fentanyl in it. I'm obviously going to use the pure cocaine first. But when the time comes that I get to the place that I don't have anything left except something that has the risk, I'm ultimately going to use that because, as the chief said, I'm so sick that I need that high. And therein is the problem when they're cutting it with this stuff. You ultimately get to a place, we may be able to delay it for a while, but you ultimately get to a place where somebody with substance use disorder, when they only have that left, they're so sick that they're ultimately going to run the risk. That's a lot of the issue.
And you talk about being able to determine what is in the drugs. A number of treatment providers and addiction services here in the North Country and the state of New York are now giving out kits with test strips to detect fentanyl and xylazine. Are you all doing that as well?
We are, yes.
There's the vending machine, which we'll get to in just a moment, and Alliance for Positive Health is giving out test strips.
Yeah, absolutely. And not only that, but what we've found is definitely leveraging the new opportunity, which is the peer advocates. certified recovery peer advocates have been invaluable in the sense of joining the workforce. People with lived experience who are able to create connections and relationships without the pressure of having to get into any kind of formal treatment. And having them equipped with the opportunity and availability to not only offer the strips, but also Narcan training, and then just stay anecdotally connected, whether that's texts or calls. That's been precious to us.
And is that something new within the past few years? Where
Past few
you've
years,
added
yeah. What we saw was COVID actually blossomed that workforce in the sense that people were willing to talk and to engage, but not necessarily come into treatment, particularly during a time in society when isolation was the healthiest way to stay safe.
And Michael, you were going to make a point.
At our campus, Champlain Valley Family Center operates a recovery center. I don't believe they have test strips available there. I think you can get them or call one of the recovery coaches that are there and get them. But we as a housing provider, not necessarily a treatment provider, are not providing test strips for this.
And Chief, the police department has teamed up with Alliance for Positive Health to set up a vending machine in the lobby of the police station in Saranac Lake that offers free fentanyl and xylazine test strips, as well as free Narcan. Why the decision to do that?
Well, in short, Tom, it's because I care about the community. I care about the region. This is where I'm from. This is my home. We all know it's a small, tight-knit community. I would dare say that probably not one of us in this room doesn't know someone that has been affected by the opioid abuse epidemic. And you know, it's kind of a cliche answer from law enforcement, but we can't arrest our way out of this problem. Certainly there are experts up here at this table that we have to be able to get these folks to them to give them a chance at recovery. And so I think by doing this, we're providing them that chance. For me, it just came down to caring about the community and not wanting to see anyone die from an overdose.
And so this vending machine outside of New York City is the first in the state of New York.
It was hard. It was hard to find a location for the machine because of being the first one. And I think what you just said is we found common ground of we both care. We care about our community, we care about the individuals, and every life is worth saving. And so getting that machine out there in an area that our program can't necessarily get to every single day was important. Our office is based in Plattsburgh, and so we can get Narcan, we can get test strips to someone within 5 to 10 minutes. It's more of a drive to get out to Saranac Lake, and so having a location out there makes it accessible to individuals 24/7.
The test strips obviously are helpful, but is Narcan really what you want to give out and get into the hands of people?
Certainly. I mean, I think, you know, all three are great harm reduction resources, but certainly Narcan, you know, in my career, I have, if you've experienced one overdose, it's too many, and I've experienced, you know, dozens, and I've seen, you know, teenagers die from overdosing on things like this. And, you know, speaking with their family, with their loved ones, if you've had to do that once, then you certainly would be supportive of this initiative. It's just so crucial to get out there into the hands of folks, like my colleagues here said, you know, so that we can save lives.
And Vanessa, New York Matters is the group that's funding this. They're partnering with you, and you're partnering with the police department.
Yes. So how it goes is we at the Alliance, we purchase the vending machine, and then we are reimbursed through New York Matters, and then New York Matters helps supply continue to supply the vending machine as we need to fill it.
And other than New York City, as we said, this is the first in this upstate region of New York. They have plans to add 14 more all across the rest of the upstate?
Yep, so New York Matters is deploying 15 machines in total, and so far they've deployed one machine, which is the one in Saranac Lake. I do not know of the other locations that the machines are going at this time, but as of right now, Alliance is only responsible for this one machine.
And is the thought down the road, the cost to install and stock vending machines like this may be financed with some of the settlement money, the opioid settlement money that New York State is seeing?
So yeah, right now they are talking about maybe using some of the settlement funding to continue to supply the machine. But again, that's just in talks, and so hopefully that'll happen down the road.
And have other groups come forward and said, we like this idea of having a vending machine? Do you think there may be interest in the coming months and years for there to be more vending machines around the North Country?
It would be wonderful to have more vending machines around the North Country. We have to be aware of the cost that comes along with it. The vending machine is a valuable resource that we have in Saranac Lake, but we would also like to have people working with our clients in the community. We'd like to have peers that you spoke on in the community. But it definitely is something that we can look into in the future, but there is a large cost that goes along with the vending machines. Since we had the vending machine in the media, we have received feedback from other areas in the North Country interested in maybe having a vending machine near them, and so that's stuff that we will explore.
And Chief, important to note these items are offered for free.
That's correct.
And no questions asked.
No questions asked.
And the idea here is for folks to be able to get Narcan, get it in their hands when they need it, and especially if it's an emergency. They know there's a place where they can go and get it.
Absolutely, absolutely. And we also have resources, in our lobby that they can take on their own, brochures, cards, things to direct them to resources should they want to seek help.
Any worry that having it at the police station might be a little too much for folks, that might be a deterrent for them to have to come there to get the Narcan or to get the test strips?
Sure. Certainly that notion or that sentiment has been expressed, but frankly we haven't seen that. We've already had the Alliance out to restock some of the rows in our vending machine. It's not a trap. We're not trying to get folks in there. And what we've seen is I received some emails the other day, some folks from one of the resources in Essex County said, hey, we were out here, meeting with some clients, realized they needed some more Narcan. Instead of driving, an hour and a half back to Westport, we stopped into your station. This was great. This was a great resource.
Overall, the response has been positive. Is there some negative feedback, though? Do you hear from some folks that don't think this is the right thing to do?
Certainly, Tom. I've heard back, from other law enforcement that have expressed to me that they think this is. One comment that was made is that this was a very liberal idea, and my response to that is we're not going to categorize this or politicize this. This is an epidemic. Folks are dying, and this is one part of the solution. This is a very complex issue that we as the police cannot solve on our own. And I don't think any one entity can solve it on our own. And I think maybe in the past we operated somewhat in silos, and that's not the case anymore. Law enforcement, I think, is working with our colleagues and working with whatever resources are available to say, what can we do to stop this epidemic?
And you believe people should have Narcan in their home, naloxone, Narcan.
100%.
I think you use the analogy of having a fire extinguisher in your home, that you have it there.
Yes, I did.
For safety reasons, and this is the same sort of thing.
Absolutely. Having Narcan does not mean that someone is going to go and be reckless. I don't think that anyone is going out and going to be more reckless as a result of having Narcan. I think it's a safeguard in the event of an overdose.
And do you believe that this being free might get it in the hands of more people, that there could be folks who don't want to go to the drugstore, don't want to have to pay the $45. Again, the stigma of going to the drugstore to ask for it and have to ask for it. So in this case, do you think this may be getting more Narcan in the hands of people who need it?
Absolutely, I do. I think that not only this vending machine, but we've partnered with the Alliance, and we've already done one community training that we had about a dozen people or so attend, and we have plans to do more in the future. But the more that we can get that knowledge out there, it's amazing still in 2023 the amount of people that you run into, that you talk to, that they've maybe heard of Narcan or they've heard of naloxone. They're not sure. Are they the same thing? Is it something something different. Some people still think like, oh, it's a needle that you have to stick into your leg, but it's really important that we get that information out there so that there's not the stigma or the confusion around, you know, what Narcan is and what its capabilities are.
And the Narcan that comes out of the vending machine, is it relatively easy to use? Can people that get that be able to use it if they need to?
It is simple. So at the Chiefs Conference, I just obtained some trainer devices. In the past, I had always used expired because they do expire after a couple of years. But I received some trainer devices. If you've ever taken a either over-the-counter or a prescription nasal spray, where basically one burst, that's essentially it. You put it in the nostril, push the button, and it injects the entire dose. So it's not like you're trying to figure out dosage or anything. It's very, very simple.
And Vanessa, Alliance for Positive Health, you folks are doing a number of training sessions around the North Country. You have one at MHAB at least once a year, if not more. Mm-hmm. But now you're expanding as well. You're having some in schools and at SUNY Plattsburgh in the coming weeks?
Yeah, so we are expanding everywhere in the North Country all the way down to the Capital Region. We recently hired an overdose prevention coordinator in both Plattsburgh and Albany because the amount of trainings that we're doing throughout the community during our syringe exchange program, providing that Narcan training to everyone, whether it's in group or individual settings.
Everybody who works in our day business, which is the warehouse business, and you know we have a lot of people that are in recovery and early recovery in there, is trained in Narcan. Thank you to Alliance for Positive Health for being willing to do this. I have Narcan kits all over all of the buildings that we own, and I carry one in my car, because I think that it's so simple to recognize that we can actually save lives with these things, that we should be training, much like we do, teach people CPR, we should be training people to how to use a Narcan kit, because it makes such a huge difference. That piece is really important.
Zach Randolph was kind enough to sit down with us at St. Joseph's Addiction Treatment and Recovery Centers to talk about the treatment options they're offering and what's changed since the pandemic.
We are still in an opiate epidemic. We know in Essex County that opiate deaths are on the increase. Anecdotally, Franklin County emergency room visits are up as a response to opiate use, so we know that's happening. Opiates are still, unfortunately, alive and well all through our nation, let alone New York State and the North Country. So yes, opiates remain prevalent. We're seeing an increase in synthetic opiates. So fentanyl, carfentanil, those are synthetic opiates. The inherent risk and danger, I would say, is more that we don't know what's in our street substances anymore, and what's in them are more dangerous than ever before. It's cheaper to produce now. It's easier to get it on the streets. Xylazine is going around now. That's a sedative and tranquilizer. That's not an opiate. The danger with that is that it does work as a tranquilizer and sedative, but because it's not an opiate, it does not respond to Narcan. The way that substance use impacts the brain, it tricks the brain in looking for its chemical, its substance of choice. And so if you are an individual struggling with substance use, I may be a heroin user and I'm looking for something different, I'll go and look for a higher risk substance to try at that point. It's the nature of the disease related to tolerance and withdrawal symptoms. If you've met one person with substance use challenges, you've met one person. And so everybody's narrative in terms of how they've been introduced, it's different. Individuals may have had like a sports injury as a young person, and as a result of that sports injury, they were appropriately prescribed some form of pain medication. Maybe later in life, there's another injury, and that compounds into using a substance more than what it's prescribed, and then maybe it turns into trying to find another substance that might be easier to get on the street. Other people may just have been at the wrong place in the wrong time, a social gathering, they were passing something around, and they decided, why not, let's try it. It felt good, and that was the beginning of their substance use. There's also the potential that maybe you had a very poor upbringing, and as a child you recognized that the use of substance helped to make you feel more comfortable in your own skin. So there's a lot of different ways, unfortunately, to be introduced to substances. And I think oftentimes that's also part of what plays into, unfortunately, the stigma of substance use. Is the assumption is that there's always a desire to want to use a substance more and more. In reality, there's all kinds of different reasons why you would try a substance in the first place, let alone continue that substance. So oftentimes, when you're talking about coming to St. Joseph's, we provide outpatient care, we provide peer care at the outpatient level, so that's not residential. You can be living at home, have a full-time employment, taking care of your family. We also do have a lot of residential programs. We have adolescent residential programming for children between 12 and 21 years old at Rose Hill up in Messina. We have specifically for veterans and first responders on our main campus here. And we have our inpatient program, which we're sitting in right now, which is a 67-bed that serves males and females. Oftentimes, it's uncomfortable for people to reach out for help. They're afraid to admit to just how bad their life has gotten. Being able to deploy peers is really helpful, because then you have someone who's kind of been through some form of lived experience of what they're going through. And again, not everybody's the same, but they're able to relate and connect, and they'll be able to share what's been successful and what worked for them and what didn't work. So the benefit there is that individuals get to meet other people that are in some form of recovery. They're able to create connections, and they're able to really leverage the opportunity to say, hey, I know you need help in substance use, but let me help you with your food. Let me make sure that you have enough clothes for the family. Let me make sure you have housing. That's been really important. The other element or service that we've been able to really leverage has been the advent of telehealth. And through COVID, telehealth exploded in terms of its availability and its approval, which was really helpful, because as you know, during COVID, the number one way to stay safe from COVID was basically to isolate. The most dangerous thing you can do if you're struggling with substance use is to isolate. The nature of substance use, when it starts to become chemical dependence and acts as a disease does, it becomes very isolating to the individual. And so families start feeling alone. They start feeling like they have a secret they need to hold on to, and they start isolating and pulling away from their connections. And you know, there's guilt that goes with that, there's shame, there's embarrassment, but again, that revolves around the importance of why we need to remove the stigma of this, because I can't think of a single person in our community that hasn't been impacted somehow by someone's substance use. There's the stigma around whether or not this is a volitional decision. If you wanted to stop, you just would. See what you're doing to your family and loved ones, just stop using substances. That's not a possibility when your brain becomes chemically dependent on something. And so there's a lot of different stigmas that, you know, once someone is trapped in addiction, they'll always be trapped in addiction. These are the stigmas that, you know, quite often come up that we see, that we try and help counteract with, you know, with truth, with information, with statistics, with lived experience, and helping people understand that, you know, the more that we try and put people in boxes, the more we're keeping stigma alive and well. And I don't know if that helps anyone. I don't think it's a secret that the North Country, we're a scrappy lot. We do well in crisis. We rally, we get together, we galvanize. And, you know, to me, that's the goal. That's the second goal we have, is to really be a part of being a change agent in galvanizing and convening providers and other resources that are in the region to get together and figure out how do we help as best we can.
Is the opioid crisis still an epidemic?
Very much so, very much so. And in fact, the CDC considers it a three-wave epidemic. It started out, looks like in 1999, they started to see an increase. 2010, there was a second one. And then we started seeing in 2013-14 just a tremendous turn upward in terms of the numbers of overdoses and deaths related, hospitalizations. What's interesting is that we're seeing just as much in terms of opiate, but also synthetic opiate. So that's opiates that are derived outside of the opium plant itself, the poppy seed. So synthetic opiates are becoming just as much of an issue, if not more so of an issue.
During the pandemic, did it get even worse?
During the pandemic is when we started hearing, I think, strongly about fentanyl being coming into our system, so to speak, in terms of what we're seeing in this area and substances. But yeah, the other substance that saw a tremendous increase was alcohol and alcohol use. And what's interesting about that, and important for people to take into consideration, is as well, alcohol use may have helped them, quote unquote, get through COVID. That's also the time when they were living with their families and their children, and their children have been watching them the whole time. And so if we normalize the coping mechanism like alcohol use, or we also saw a big spike in marijuana use, we're seeing substances be used as coping mechanisms. Then what we've done is spent 3 years teaching our children that those are coping mechanisms. And so there's a high risk with that as well. And I don't think we started to see an uptick in mental health needs, and we've certainly seen a need for services in terms of substance use and mental health service increase. But I think that's just the beginning. I don't know if we can honestly assess where we are in terms of after COVID and how substances played a part in helping society cope, right, wrong, or indifferent.
Are we at least seeing the number of overdoses drop after COVID?
It looks like ER hospitalizations due to overdoses might be down a little bit in some of our counties, not all of our counties. Overdoses in terms of deaths per year are still high and higher than normal. So, you know, we could make a lot of deductions out of that. My concern would be is that while there might be fewer people landing them in the ER, what those that are using is much more high risk and dangerous, and that's why we're seeing the overdose and them leading to death.
And are more people seeking your services? I'll ask it both you and Michael.
Yeah, I'm pretty sure if you ask that to the full panel here, we'd all say that our services and the people in need for our services asking for them are up across the board in terms of substance use, co-occurring, mental health, you know, and even daily living skills, soft skills, how to interact with each other, how to be there for each other, how to support each other. Those things dwindled during COVID because we weren't around each other. So I think we got out of practice, and we need a little bit of help getting back to where we're able to take the time to take care of each other and recognize the value in that.
Yeah, Michael, you mentioned Champlain Valley Family Center has the treatment facility at your location, but you provide a lot of the support that folks need to take that step for recovery.
And I just want to go back and commend the chief for what he said, because I think that law enforcement has done an incredibly good job over the last 6, 7, 8, 10 years in bringing down the idea that we're going to arrest our way out of this. And law enforcement has reduced the stigma with regards to people who are struggling with this. There's still that divide where people look at law enforcement as the enemy, but it's much less than it used to be. And my hat's off to law enforcement for doing that. We've seen it here, where the people understand that law enforcement isn't just out to get me and throw me in jail. They're actually trying to help me. So I think that that's great, because anytime we get those two factions talking to each other like people as opposed to talking at people, we do better. And I will, and then I'll come back to your question, Tom, but the Narcan piece is so huge. Vending machines are wonderful. We ought to be giving Narcan out at the Department of Motor Vehicles when people go to get their light. I mean, there are easy ways to do this just to get Narcan into the hands of everybody. And if Oasis, with their somewhat bloated budget, would just take the money and say, make enough Narcan kits for every individual in the New York State to have a Narcan kit, would make a lot of sense to me. So, I think of that. In the case of us and what we do, because we're not a recovery center, we're a housing first model that works with the treatment centers. I echo what Zach said. I think right now the hot button item is fentanyl, xylazine, and the opiate crisis. But if you go back and look at the history of drug abuse in the United States of America, there's always something different. And this will get cleaned up, and we will figure out a way to eradicate this, and then there will be, or calm it down, and then there will be a new drug that will take over. With that said, what we really need to be doing is not necessarily looking at the symptoms, but looking at what's causing our society to do this. COVID was incredibly dangerous to people that are afflicted with this illness and mental illness, because the opposite of those two diseases is connection with people. It's the reason why there's such a push for peer advocates. This all comes out of, go way back to 12-step work. It all comes out of those things that say what we need to do is have people that are afflicted with this have connection with people that they look to and they trust. And until we actually get to that piece, we continue to do this. And the last thing that I'll say is that if you look at the number of people admitted to Zach's place or any of the other treatment providers, I don't know this for a fact, but I would venture a guess, many of them are, for lack of a better term, repeat offenders. And what that tells you is that we have to do something so that once we get people in there, we grab them and we hold on to them for a period of time until they're ready to live alone. With all due respect to Zach's program, 30, 60, or 90 days is nowhere near enough. If we believe that we're going to treat somebody who's afflicted with substance use disorder for 90 days and they're going to leave and they're going to be fine and be able to live their life, we're lying to ourselves. That's what MHAB was put in place for. It's a 2-year program to allow people all of those soft skills. Learn how to bank, learn how to shop, learn how to do your laundry, learn how to interact with people, learn how to say please and thank. Like all of the things that come natural to a lot of us don't come natural to people who are afflicted with this and have been afflicted since a young age. That's where the real stuff needs to happen.
And are services expanding for you, Zach, or since COVID, and now are you expanding? You mentioned you have brought in the peers. Are there other steps and other things you're doing that are new initiatives?
Yeah. So there's a few different areas that we focused on, and what we're really looking at now strategically is provider partnerships throughout the region, recognizing that we all have our unique strengths. Like Mike just referenced, you need an inpatient treatment program. You also need an outpatient treatment program. You need long-term residential, anything and everything. And I think one of the things the North Country's historically been good at, and we're just trying to highlight this afternoon, is just how well we work together, and that we do have some common ground and we do have commonalities that we can build from. So, it's practical. It's about practical expansion. What's relevant to the communities? One of the areas we talked about with the opioid settlement funding, St. Joseph's received some funding for community outreach and engagement services. What this is going to do is allow us to mobilize a mobile unit to go out into the communities, into the counties, and look for people struggling, look for people engaged in active use, and find them, meet them literally where they're at, and have a conversation. Do a wellness check. Just see if their basic needs are getting met and how we can help them find those needs and potentially create a connection. So this isn't about trying to just constantly usher people into formal treatment. The idea of expanding practically is about just meeting people where they're at, making connections, trying to engage them, make sure that they have what they need so that maybe tomorrow they make a different decision. And so that's a big area of expansion that we're focused on, is experiential, soft skills like we talked about, and that peer interaction without the pressure to get actually into treatment.
And you do have new partners. You're teaming up now with Citizen Advocates.
That's right. We are working with Citizen Advocates as a premier partner. But again, what that is one example of what we would like to see as a region of how do we leverage each other's strengths, how do we recognize each other's specialty, and allow each other to do what we do best, and not sense that as competition or sense that as anything other than just us coming together trying to pool limited resources for maximum benefit to the communities.
The illness we're talking about, we say it's an illness, we talk about it in terms of a disease, and I think everybody up here believes in it. But remember, it's a chronic, terminal, fatal illness. Like it takes a long time, sometimes a lifetime of people living in recovery to actually get to that place where we don't have to worry about them anymore. That's the reason why it's so important that we have these things. And Zach brings up an incredibly great point. In this area, and I use Clinton, Essex, Franklin County, I guess, as our area, all of us work really well together. Very infrequently will I call somebody and have there be a silo anymore, or somebody can't get treatment for this. Just in our community, some of the providers are now tied in with both OMH and OASIS so that they can give both, as opposed to sending somebody who might have two things. And you asked about what we're doing. Champlain Valley Family Center will open up a 24-hour-a-day crisis center at the MHAB campus sometime next year. It's in the last round of financing at the state level, and that will be terrific because right now we're going to Malone. If we have somebody in Clinton County who's in crisis, we're putting them in a car and driving them to Malone. So sometime next year we'll be at a place where we'll have a walk-in place, no charge, no stigma, just come in. And what will happen is the people who are there will say, okay, let's get you to, we need to call Vanessa at Alliance for Positive Health because what you need is to go to there, or we need you to go to inpatient at St. Joe's and we know the people, so let's get you in there. So the key is get to them early and then hopefully get them to the place that they need to be.
And Zach, you provide those services as well.
That's right. That's right. And again, the point is that we need services all throughout the region as accessible as possible. So if Mike's doing it up here, that's great. We'll do it where we can do it. And if Vanessa and her team, that's the way that it works, is we got to be able to rely on each other. And I think one of the things that we're trying here is trying to recognize each other's strengths, leverage those and allow those to happen, because there is funding coming in. You have to be really flexible and prepared to let go of funding opportunities to let your partners have a better opportunity if they're suited to be able to provide it. I don't necessarily know if we continue going after the same amount of resources continually, we're ever really going to create a better system. I think what we have to do is be more cognizant of how do we support each other as we build this system together.
And there's about now $2.5 billion in opioid settlement money that's coming in, helping both of you gentlemen, Vanessa helping Alliance for Positive Health. You folks have been able to take some of that money, or you're going to use some of that money to hire more staff.
Yeah, so we expanded down to the capital region. Alliance has 5 different offices: Albany, Glens Falls, Schenectady, Plattsburgh, and Hudson. So we have expanded down into the capital region. Previously, our syringe exchange can only cover a certain region. And so throughout New York State, there was only one syringe exchange that could cover the region, and we realized we need more help. We can't do it on our own. We can't be the superhero on our own. We need to lean into each other and work alongside other organizations.
And Chief, any settlement money coming to police departments?
Yes, so we applied for almost $95,000 out of the approximately $500,000 that Franklin County was awarded, and we were awarded for both of our initiatives that we presented. So one was we purchased a TrueNarc instrument, which is essentially a scientific instrument that officers can use to test suspected drugs, and they can essentially get a readout right there with very little handling. I mean, you can literally take a package, scan the item through the package, and it'll tell you that it's fentanyl. In the past, officers were, taking samples of those drugs, putting them into small kits, handling these drugs that are, fentanyl, other things like that. And we actually had an overdose in our agency a couple of years ago, and I know of several others just in local agencies where officers have become ill from exposure to these things. So that's about a $32,000 instrument that normally a small police department would not be able to budget for. So now I think we're one of 3 in the North Country. Plattsburgh and the state police have one. So we have that, and we're allowing other nearby agencies to utilize it. And then we also applied for and were awarded grant funding for an initiative that I called COPE, Community Outreach, Prevention, and Education. So I think one thing that I've heard a lot up here from my colleagues who are obviously experts in their fields is that this is co-occurring. We can't just treat the addiction side of things. It's what is leading people to these addictions. Is it mental health disorders? I truly fear what we're going to see in the next 7 to 10 years with some of these 5th, 6th, 7th grade age groups that that were in that 8 to 12 or 13 age group when COVID went through, right? We took them away from their friends, we took them away from peer support and socialization, and a lot of them were left to their own devices. Mom and dad were working, so they're either on the internet or, like I said, they just didn't have a healthy coping mechanism. So I really, I have some fear about what's going to happen with the mental health of some of that age group. These folks cannot go out and interact with the number of people that we do on a daily basis, whether we're making a traffic stop on someone, whether we're just saying hello to someone out on the street, just having casual encounters. We are going to come upon these folks that are in crisis. It's apparent that we need to, then kind of provide the information to these folks to get them to the resources that they need. We work with citizens advocates. We have a program called CALIP, Counselors and Law Enforcement Partnership. And so we have a counselor that essentially works hand in hand with us. So we're constantly providing feedback to them of, hey, we talked to this person today. They've got some things going on. We think it would be good for you to follow up. Obviously with HIPAA and everything, we're not getting feedback, but they'll just say to us, okay, we'll reach out. They may let us know, like, hey, we made contact with that person. But then we're just getting them into, the appropriate resource.
The state and OASIS getting that settlement money out. I know there was a coordinated task force that met within the past couple of months. Is that money getting out to where it needs to go quickly enough?
I think if you ask most of us, we would say, no, it didn't happen fast enough. But it's because people have been dying regularly by the minute for years, and nothing can happen fast enough. But is it flowing? Yes, it's flowing. I mean, just sitting from my chair from January to now, the amount of funding that's flown out as a result of these opiate settlement dollars, it's been tremendous throughout the state. And we talked about a little bit about the community outreach, but we've also, St. Joseph's got funding to offset the cost of training staff for their CASAC credential, was their Certified Alcohol and Substance Abuse credential. So there's been money that goes into trying to fill out the workforce, which is big. St. Joseph's was also awarded funding so that we can operationalize an integrated methadone clinic with our outpatient clinic in Saranac Lake. We submitted and received an award to operationalize, it's called an IOTP, an Integrated Opioid Treatment Program. And so what that is a methadone clinic. Okay, so people will come daily and get their methadone dose and then go about their day. You can do guest dosing and whatnot. What they want to see, which we are completely supportive of, is that it's integrated with an outpatient clinic. The reason why that's so practical is because if you're going to see them regularly, you also literally have the staff you need to keep them engaged should they need supports and services. So in Saranac Lake, we have the Robert Rice Community Center, which houses the outpatient clinic, our open access center, which has a peer on call 24/7, and we will operationalize this methadone clinic.
And talking a little more about the settlement money, does any of that settlement help clients with the cost of recovery?
Not that I'm aware of directly. It hasn't gone to any pool or anything that I'm aware of that can be leveraged to pay for treatment. That's primarily on the insurance companies and managed care organizations.
Does insurance cover most of the cost of recovery for most people? I know every case is different, but do most people get their recovery costs covered?
The truth is, no, I don't think insurance companies are paying the treatment providers enough money, or it's not long-term enough. I think that in the end, for me, I don't get any insurance because I'm just a housing model. They have to pay for it, or DSS pays for it, or I absorb it. But there's another facet of this that should be leveraged, and that leverage is with private business people who reap the benefits of people finding their way into recovery but don't necessarily pay for it. One of the new initiatives in New York State, and I've been doing it for years, is to make work-friendly or recovery-friendly workplaces and get the employers to understand that somebody in recovery is going to become a great employee for you if they're doing what they're supposed to. And for that, you should be giving something back so that they can spend the time that they need to.
Zach, you mentioned about the mobile unit that you folks have at St. Joseph's. Now, you folks have grant money now, Vanessa, for Alliance for Positive Health to get a mobile unit as well. What will your mobile unit do?
Yes, so we recently were awarded a grant that will provide our agency a mobile unit. This mobile unit, it's an RV. It's going to be on the road by February 5th. And for the first 6 months, we need to be in Clinton, Essex, Montgomery, and Greene counties. Those are the counties that we identified. Our goal is to reach the people that we're not reaching right now, get into more rural areas and provide services. That's HIV, Hep C testing, STI screenings, providing COVID testing, COVID resources, connecting people to vaccinations. But we're also going to be doing syringe exchange out of our mobile unit. We're going to be providing telemed out of our mobile unit because connecting people with providers based on where you are located is a huge barrier.
And the idea is these may be people who won't drive to Plattsburgh for those services or to pick up Narcan or test strips. Will that be part of the mobile unit as well, that you'll be giving out Narcan?
Exactly. Wherever we go, Narcan goes. And it's not even won't drive to Plattsburgh. Sometimes they can't drive to Plattsburgh. And so we want to make sure that we are meeting our clients where they're at, meeting community members where they're at. And we're hoping to reach new people that maybe we're not working with currently by being out there.
We are still in a crisis. We're still in the midst of an overdose epidemic, but is there optimism, perhaps now that we didn't see or feel even a few years ago, that we are making progress or can make progress?
I think the optimism is that we're here and we're having the conversation. You know, to have 4 different entities all moving in the same direction with the same common goal.
I do think that the numbers are still very scary. I mentioned earlier, lives are still being lost. But the conversations are being had. They're being had at our dinner table. They're being had with family and friends. The conversations are being had, and that's what's really important.
In 30 plus years of doing this, I personally know more than 200 people who have died from this disease in some form or another. 200. It's way too many. My goal for MHAB, and I'm a private business person, my goal for MHAB is to close the doors. If I had to just pay the mortgage off and eat the money, it would make me happy, because that would mean that we've eradicated the problem that's destroying American families.